Nearly 1 year ago, regular coronavirus testing began at hospitals around Alabama. Nicolette Schleisman is asking the Chief Medical Officer of University Health how testing has changed over the past year. She is live outside University Hospital now. What is he saying about where we are now in the fight against COVID, Nicolette?
Well, Cherish, Dr. Michael Chang says right now that we are in a lull and we're not out of this by any means. Capacities at the hospitals in our regions are about what they were during September and October, meaning they're full, but they're still seeing some COVID patients and they're not overflowing at this point. But he does say that we've also come a long way in the past year, even just with testing. At the beginning of the pandemic, getting a test was difficult. You had to meet strict guidelines to even be tested. Now that's all different. You can get tested fairly easy and you don't need to meet requirements and can get results in about 15 minutes. Cherish?
And Dr. Chang says we're in a lull. Explain exactly what that means.
Well, he explained that, again, this is a lull and it's because we've exited that third wave of the coronavirus, and they're hoping that there's not going to be a fourth wave at the end of this lull that we're in right now. It all depends on what people do, and the key point is making sure that those hospital capacities stay down so that they can treat other patients, not just for COVID.
So what is he saying can be done to avoid filling up hospitals with coronavirus patients?
Well, Cherish, it's nothing really new. It's the things that we know. He says we need to maintain the vigilance with keeping our social distance from others, as well as wearing those masks and, of course, washing your hands.
And always in public. We heard that yesterday, even with vaccinations, also in public. Thanks, Nicolette.